Hi everyone, my name is Megan Fosco, and I'm a pelvic health physical therapist at Hudson Valley Physical Therapy in Hartsdale, New York. I'll be completely honest with you. When I was in physical therapy school as a student, we had one lecture in my first year on pelvic floor physical therapy, and I was not immediately hooked. Years later, I'm sitting here. I absolutely love what I do, and I'm talking about how awesome pelvic floor PT is. For those of you out there who have heard of pelvic floor physical therapy, there's a lot of misconceptions. And then there are a lot of people out there who have no idea that pelvic floor physical therapy even exists. So I'm here to just give you the basics. Starting here. This is a pelvis. This is a female pelvis, pelvic floor. So everyone has a pelvic floor. Male, female, trans, young, old, everyone in between, you all have a pelvic floor. And before I got really involved with pelvic floor physical therapy, I thought that the only patients who needed pelvic PT were older women experiencing incontinence or new moms experiencing incontinence after childbirth. And if this were the case, I'd be very bored as a clinician. At Hudson Valley Physical Therapy, I have the privilege to work with individuals experiencing incontinence, but also individuals experiencing a variety of pelvic floor dysfunction. Pelvic floor dysfunction includes things like pain with sitting, pain with sex, low back pain, hip pain, groin pain, SI joint pain, urinary frequency, constipation, and pelvic organ prolapse, just to name a few. We also see many men and women with painful scars at Hudson Valley Physical Therapy. These scars result from abdominal procedures, cesarean birth, episiotomy. For more information on all the conditions that we are specialized in treating at Hudson Valley Physical Therapy, you can visit our website at www.hudsonvalleypt.com. According to the Society for Urologic Nurses and Associates, it takes 6.5 years for women and 4.2 years for men to seek treatment for pelvic floor dysfunction. Basically, people are coming in when things are very bad and they can't live with their condition anymore. Why is it taking so long? So what I've seen in my experience is that a lot of people believe what they're going through is normal. And according to the report I just cited, 38% of men and women who were interviewed believed that incontinence was just a normal part of aging. After childbirth, many women leak. It's common, but it's not normal, and there's a big distinction between what's common and what's normal. A healthy pelvic floor should never leak. Constipation is another great example. Many people out there are constipated. It's a very common problem, but an individual with a healthy pelvic floor should not be constipated all the time. We also see a lot of patients come in and they say things like, my bladder is small, I've always had to go a lot, or I drink a ton of water and that's why I'm going a lot. Someone with a healthy pelvic floor should be able to wait 2 to 3 hours between voids. Going every hour is definitely not normal. So this is just part 1 of my basics of pelvic PT. Part 2 will be coming soon. So if you or someone you know may be experiencing pelvic floor dysfunction, I encourage you to learn more. You can visit our website at www.hudsonvalleypt.com. Follow us on Twitter, Instagram, or Facebook for more information. Or there's a variety of resources out there online. 2 great resources are the Herman and Wallace Directory of Practitioners to find a pelvic PT in your area, and the American Physical Therapy Association section on women's health also has a PT locator. For those of my PT colleagues out there, I encourage you to call up your PT friends in the pelvic PT world, and don't be afraid to ask questions and learn more.